This first photograph that we're going to review is of a woman with PSP, and what you see is a somewhat anguished look on her face. There's slight opening of the eyes, though on many patients with PSP there is more of an eye-opening or surprised look to their face. We're evaluating the saccades of an individual with PSP. There is mild slowing of horizontal saccades. However, in the vertical direction, there's significant slowing, and there's also vertical ophthalmoplegia in the up-gaze direction.
Look at my thumb again. My nose, thumb, nose, good. And my thumb, and my nose. Look up at the ceiling, and then look down at your lap. Good, and the ceiling.
In the same woman with PSP, we're testing optokinetic nystagmus. In the horizontal directions, she follows the direction of the tape and makes small but impaired fast corrective saccades. However, in the vertical direction, there is a gradual up-gaze and down-gaze with no fast corrective saccades. Here, while testing postural stability, she falls backwards with retropulsion, even without a tug on her shoulders, which would be the normal test for retropulsion. As is typical in PSP, there's more axial than appendicular rigidity, which is shown here with resistance, especially to neck flexion and extension, out of proportion to what is seen when moving her arms. As has been mentioned, the bradykinesia of PSP is typically axial. However, in this clip, you see severe bradykinesia and hypokinesia of finger tapping movements bilaterally, a little worse on the left side. This is also present for hand grasping motions on the left and right side. As well as with foot stomping for both of his feet. And the left foot is almost impossible to lift. As is often seen in PSP, there's an uncontrolled descent or plopping or crashing down into a chair, though for safety reasons, he is helped back into his seat. As previously mentioned, the applause sign, or the patient's response when they're trying to imitate 3 claps the examiner makes, is quite prolonged in some individuals with PSP as a sign of perseveration and possibly inhibitory control. This gentleman continues to clap until he is stopped eventually.